Welcome back to Western New York Living. I'm sure many of you didn't realize that May is Women's Health Month. You may also not be aware that vascular concerns can differ between women and men. And Dr. Linda Harris from UBMD's physician group joins us now to talk about the importance of women's vascular health. Dr. Harris, thanks for being here.
Thank you very much for having me.
So what is the UBMD Physicians Group?
The UBMD Physicians Group is the largest group of physicians in Western New York, and it encompasses the faculty who are involved with teaching and research in all forms of medicine, and I'm part of the surgical group, specifically the vascular surgeons.
Now, we mentioned that May is Women's Health Month, and we want to focus on vascular health. So what are some important facts women need to know about that?
Well, number one, women can have vascular disease. About a decade ago, if one of us went to the emergency room with chest pain, no one would have thought about cardiac disease or a heart attack. Women actually have a higher rate of having peripheral arterial disease or blockages in the arteries than do men, partly because we live a longer time, but partly because we behave differently. Women have a higher rate of having a lot of problems and often present in a different fashion. 1 in 5 women will have a stroke in their lifetime.
That's amazing. That's an amazing statistic. Now, screenings are very beneficial, and there's a condition called abdominal aortic aneurysm. Tell us about that and how screening can help.
Sure. The problem with aneurysms is that most of them have no symptoms whatsoever until they rupture. And obviously that's not how you want to present.
Right.
So there's been a lot of research in the area, primarily with men. And so the government now in our country actually provides for a one-time screening for men who are 65 and have smoked or have a family history. It's not approved for women at this point. Having said that, the benefit financially is the same for women as men. Women don't have aneurysms in the belly as often as men, but when we have them, they rupture at a smaller size and they grow faster, and the outcomes aren't as good. So economically, from the studies we have, it makes just as much sense to screen a woman if there's a family history or if she's been a smoker as well. And women, when they have aneurysms in the belly, have a 39% chance of having one in their chest, whereas men only have a 16% chance of having one in their chest if they have one in their abdomen.
Important information. Now, what are some other health issues women may face?
Women face a lot of problems. They can also have aortic dissections, which is a rip in the artery. That's actually how Lucille Ball died, if you may be aware. And that's something that, again, often presents without or comes without symptoms until the event actually occurs. Hardening of the arteries in the neck, which can cause stroke. Women, of course, also do have venous disease and deep vein thrombosis, which is blood clots in the leg, which can embolize and cause clots going to the lung. So women can present with all the same problems that men present with, but they often present in a different fashion. When women have a stroke, there's much more often atypical symptoms, things like a change of level of consciousness and headaches. And those sort of things may confuse the emergency room physicians or may confuse patients so they don't present as rapidly. Women, unfortunately, tend to present later with almost every type of vascular problem. When they have peripheral arterial disease, we tend to see them when they have what we call critical limb ischemia. In other words, when their leg is already at risk because they have sores on their feet or gangrene, whereas men will tend to present sooner with pain in the legs with walking. So some of the differences in outcomes may be related to the fact that women present later in the course of many of these diseases.
All great information, and I would say I never knew that there would be different symptoms between women and men.
Unfortunately, there are, and that's part of what we're trying to educate everybody about, ourselves, the primary care physicians, and the public as well.
Glad you were here today.
Thank you much.
Thank you, Dr. Harris. UBMD Physicians Group is Western New York's largest medical group with more than 500 physicians and 18 practices. To find out more about their primary and specialty care, you can head over to their website at ubmd.com. You can also give them a call at 859-4225 to speak to their helpful staff. UBMD Physicians Group is committed to giving their patients the best care in the region. Now, coming up next, we're going to take a unique look, an easy way that you can help animal shelters in our area find forever homes for loving pets. And after that, the Juneteenth Festival is fast approaching, and we'll have a preview of this fun weekend and take a look at some of the wonderful activities they have planned. Western New York Living will continue.
Special consideration for today's show paid for by the following: